Okay, sorry about the delay. We're just trying to find the slides on Grant's computer. So we'll make a start for today. So today's webinar is really just a quick update on the benefits of stopping smoking prior to surgery. And this is an area that many of you would have worked in, or you'll get people referred to you from the hospital system. But it's a time that many surgeons, of course, want their patients to quit smoking. There's a little bit of pressure sometimes, especially in areas where smoking is really detrimental. So plastic surgery in particular, so anything that involves small blood vessels is really important to quit. So just to refresh you on the smoking-related surgical complications, there are effects of carbon monoxide on its own. So as you know, carbon monoxide binds to hemoglobin, which decreases your oxygen carrying capacity. And when you're undergoing surgery, especially with wound healing, you really need as much oxygen as you possibly can. Carbon monoxide also thickens your blood, so it increases the resistance to blood flowing through your blood vessels in particular. So that's the increase. And arms and legs, and anything where you get to the small blood vessels. As the blood becomes thicker, it's more difficult to push through the smaller blood vessels. So that's not a good thing, obviously. Smoking also causes airway secretions. Smokers know this. Phlegm, mucus, yeah. You get effects on metabolism of drugs, as you know, so smoking affects the metabolism of a number of different drugs. And smoking just affects the mechanism responsible as well.
So you take longer to get surgery, the scar will take...
Yeah, often longer to heal. I mean, we're talking days, but also there's infection, so you're infected from that. Now, in terms of big, major surgery, especially surgery that's on the abdomen, or if you're having gynecological then these post-operative pulmonary complications. So that's collapsed lung. That's what atelectasis means. You get bits of your lung that collapse. And pneumonia, I think you all know that that's infection of the lung. They're really common after these abdominal surgeries, and that's because you just can't move your diaphragm so much because of the pain from the surgery. Okay. Now, if you're smoking, then you've got a six-fold increase in the risk of these lung collapse and pneumonia. So that's quite significant, especially following these surgeries, because lung collapse and pneumonia are associated not only with being sick in hospital for longer, but a higher chance of dying.
Right.
Okay. So
I was just what is the difference between, on the slide, what is the difference between morbidity and mortality?
Oh, good question. So morbidity is sickness, mortality is death.
And is it morbidity sickness that's going to lead to your death, or is it
not necessarily? It could be just sickness that increases your stay in hospital, or that you develop more problems. If you went in there just because you had a bit of bowel surgery to do, but then you get pneumonia as well, then that's an increase in morbidity.
Right. Okay.
Now, in terms of surgical wound healing, cigarette smoking's associated with both delayed wound healing, and as I said at the beginning, and this is a particular concern with reconstructive surgery, or plastic surgeries as perhaps more commonly known, but also with bowel surgery. When you, let's say you cut a piece of bowel cancer out, or have to do something else, and then you try and join the ends of the bowel together. That's the anastomosis, where you join it together. Then if you smoke, there's an increased risk of leakage, because that join doesn't heal so well.
Right. Okay.
So you don't want delayed wound healing. You also get delayed wound healing if you have some bone surgery as well, especially in the ankle or in the back. And if you don't get the bones fusing together properly, then that's also problematic.
Right.
Wound infection. No one wants wound infections, because that just keeps you in hospital for longer. You have to take antibiotics for longer. And smoking increases the risk of wound infection. Hospital stay, as I've mentioned already, People who smoke are more likely to be admitted to intensive care following the operation, more likely to spend time in other departments. So for example, if you smoke, you have some surgery, and then you have a heart attack, then you have to spend, often get shifted around departments.
Yeah.
So overall, they have longer stay in hospital. And longer stay in hospital not only costs the health system, obviously, but it might also cost you in whānau if you can't get out and work so quickly. So this is why everyone's so keen to help people stop smoking prior to surgery.
And so, how do people who are scheduled to have surgery, how do they know to stop smoking? Who tells them this?
So they'll probably have a number of different people that will tell them. Their surgeons will tell them, especially if the surgeon's a plastic surgeon, for example, orthopedic surgeon. Their anaesthetist will go through this as well, because there are risks of smoking with having a general anaesthetic. And probably a number of other people like the nursing staff in the pre-admission clinics.
And do those people, are they good at referring people?
Well, we've had sort of this brief advice for quite some time now, and it depends on the message that you're giving. And I think one of the ways that you could perhaps get across a more simple message would be, look, just stop for your... Well, I'm just not asking you to stop forever, but actually stopping smoking prior to surgery has so many benefits. And here they are. We can get rid of the carbon monoxide. We can improve your wound healing. Improved wound healing means you'll be able to get home faster. You have a decreased risk of pneumonia and lung collapse and other complications. So this is really important. And the bit in the box here, complete cessation is needed. Just cutting down doesn't really convey any benefits.
And so how soon before the operation
the longer the better. If you can stop 8 weeks prior to surgery, that's pretty good. But even if you stop just before, and we'll have some slides on this soon, that's still an advantage. Okay. And for many people, I think just keep this in mind. If you're having major surgery, if you're having a coronary artery bypass graft, you've got new vessels that have been stitched around your heart, just having this major surgery can increase your chances of quitting long-term by 50%. So it's a very important time for people, and they're often in a much better space for thinking about quitting than other times. And I mentioned this, quitting, is it quitting for good, or is it just quitting for your operation? And this is something, stop before your operation, but maybe it's better to say stop for your operation and just keep it as simple as that. Obviously, if they could go on to quit smoking long term, that would be better. But even if it's just for the operation, that would be a good thing.
And so most surgeons and most anaesthetists would know this.
Yeah, absolutely. Okay. Yeah. What they don't always know is that there's support there to help people to quit smoking. And I just don't worry too much about this picture. But this is from the Cochrane review. So it's looking at all the studies that have looked at preoperative smoking cessation. And here they've split it into intensive behavioural intervention. So this is multi-session behavioural support with pharmacotherapy. And in these studies down here, they were more brief. Here's a computer program that might help you, or here's just a few phone calls. Now, if you're looking at the effect, i.e. the proportion of people that stop smoking at the time of surgery, you can see the much greater odds of quitting smoking here if you have an intensive intervention versus if you have a really brief one.
Right. So basically you could say if all hospitals were referring their people who were due for surgery to a stop smoking service, their outcomes would be much, much better.
Absolutely, right, yeah. And that's the same across the board. We know this. If we can encourage people to use the stop smoking services, you get a better outcome. And that's what we want. Now, the Cochrane review also looks at smoking cessation at 12-month follow-up. So this is past their surgery, and are people still not smoking? And again, if you have an intensive intervention, you're still more likely, the odds of quitting longer term are still higher than the odds of quitting if you have a more brief
Like get a pamphlet from the surgeon.
Yeah. But if you're looking at post-operative complications, then it's only the intensive intervention that really has a significant impact. Having these sort of brief interventions had no effect on post-operative complications, and it will be primarily because the more intensive help more people stop for longer. And that has positive benefits in reducing post-operative complications. That's one of the best things you can do prior to surgery. Now, Grant, you asked before about timing. Now, there has been, this is quite old research now, but this is saying that those who stopped, these are people that underwent coronary artery bypass graft, CABG. That's often what it gets into. Yeah. This is your heart bypass sort of stuff that people commonly describe it as. But in this study, those who stopped smoking 2 months, less than 2 months before their surgery, still had an increase in these post-operative pulmonary complications than those that stopped for 2 months or more.
And remind us what they are again.
So the post-operative pulmonary complications are pneumonia and lung collapse.
Lung collapse.
Yeah. Okay, so this study said, look, you really need to stop smoking at least 2 months before your surgery. But then the downside of that is people go, oh, but it's too late now. What's the point in stopping? I'm too close to my surgery. I might as well carry on smoking. And some colleagues of mine looked at this and actually found there's no evidence to say that stopping smoking shortly before your surgery has a negative impact. So it may not be as positive as if you stopped 8 weeks or more ago, but there's certainly no increase in risk. So the bottom line here is, look, just stop.
No matter what.
No matter what time point. Ideally, it should be as far in advance as you possibly can. So if you're working with DHBs, the idea would be to see people as soon as they're booked for surgery. Right? So they're on a waiting list, get them stopped way ahead.
Because often it's 6 months or more,
it could be, yeah. So it's about getting some things in place, some good systems in place to make sure people get referred as early as possible. Now, what about nicotine? I'm sure a number of you out there have dealt with anaesthetists or surgeons that do not want their patients using nicotine replacement therapy prior to surgery. Okay. Now, there have been these concerns out there that nicotine on its own may increase the risk of wound and cardiovascular complications. Now, I think we can all say in New Zealand that we're quite comfortable with using nicotine replacement therapy, and even people that have had a heart attack in the last couple of days. Okay, we've sort of moved on there. But there are still some surgeons that prohibit the use of any nicotine in the period around the operation. Now, if you're interested and you want this paper, there's a nice review published in 2015 that looked at the data on the risks of nicotine prior to surgery.
When you say prior, how long?
At any time prior to the surgery. Okay. So let me just give you some of the facts and the findings of this review. Now, as you know, and as we've talked about already this morning, we know that smoking increases the risk of complications around the time of surgery. That's a fact. We also know that NRT with behavioural support, I don't think NRT on its own without support is particularly effective anymore, but with support, that's going to increase the chances of stopping smoking. And we know that stopping smoking reduces the risk. Okay, so they're the two main facts. Now, what about this risk around nicotine? Well, there are some animal studies that show that when you expose animals to very high levels of nicotine over time, that can impair wound healing. Not always, but some studies have found that.
So it's in mice and stuff like that?
Yeah, might be in mice or rabbits or something. But when the studies that look at lower doses of nicotine that are more similar to the nicotine doses you get from NRT, it has no effect, no adverse effect on wound healing. And that's in animal studies. Now, what about humans? Well, again, we know that smokers have less blood flow through their small vessels that run through the skin compared to non-smokers. We know that. We know that stopping smoking, even using a patch, in smokers actually normalises this. So
because it's the CO, the carbon monoxide.
that's part of it, but it's other things in tobacco smoke as well. So the human studies using NRT actually don't negate the benefits of stopping smoking. So stopping smoking with NRT, you still get these benefits.
Yep.
So you still get improved blood flow, which is a good thing for healing. So here's a quote from this paper, which I think might be useful if you're having to deal with surgeons. They say, although available data are limited, there is no evidence from human studies that NRT increases the risk of healing-related or cardiovascular complications. Clinical trials of tobacco use interventions that include NRT have either found no effect or a reduction in complications. So you're not going to make things worse by switching people to NRT, and actually it's probably more likely that you reduce the risks of these perioperative complications.
So bottom line is, if people are using NRT and they've stopped smoking just prior to their operation, the NRT that they're using is not going to make any difference to the outcome of their surgery.
Correct. Yeah. Yeah. And remember, we've talked about nicotine here, but there are non-nicotine solutions as well. So you've got varenicline or bupropion that you could use in many of these people. So there are, if you have someone that's really anti this, then you could use one of the non-nicotine products.
And so would there be surgeons and anaesthetists who tell people, oh, you can't be on Champix or you can't be on...
I don't think that most surgeons would know that much about those medicines. And remember, varenicline doesn't really have any clinically significant drug interaction, so it's a good medicine to use during surgery as well. Yeah. So there's 3 main points from this. If you've got people undergoing surgery and they smoke, they should be advised and assisted to stop smoking as early as you possibly can. Okay, but it's never too late. If you're going to help people stop smoking, the evidence suggests that more intensive interventions are better, associated with higher quit rates and also a decrease in the risk of complications. And if you're going to use NRT, it can certainly be used in the perioperative period. And especially true if this is what stops them from smoking.
Excellent. Thank you very much.
Okay. Questions?
Stop share. Stop share. I think it's fine. I need to turn unmute everyone.
How do I do it?
If you've got questions, you need to unmute yourself.
Okay.
Okay. So can people, oh yes, that's any questions from anyone? What does intensive support look like? Are you saying face-to-face? Intensive support means multi-session behavioural support. I think we are probably moving to sort of a hybrid model where we've got a little bit of face-to-face, a little bit of telephone maybe, or a little bit of text. But it's about staying in contact with people and making sure you follow them up. Not a one-off, good luck, here's some NRT. My feelings on nicotine replacement therapy without any support. It's probably a waste of time and money. So if you're seeing people on a regular basis, following them up, that's what we're talking about here.
Right.
Any other questions? That was obviously clear.
Is there anything?
Is there anything happening in doctors' world to support this type of practice? Brenda, that's a good question. It depends. I mean, the medical community has moved on quite a bit in this field, certainly with the guidelines, but there will be still some surgeons that hold on to the belief that it's nicotine that causes most of the harm and do not want their people on NRT. So you may have to have that conversation with them if you come across them. If you want that review paper, let me know. Happy to send that to you. But it's sort of step by step, slow change.
Do you know of any hospitals in New Zealand who systematically refer people on a waiting list for surgery to stop smoking services?
A number of them do. So Waitemata DHB has often been really good at this, and they've written that up in a paper too, looking at referral to stop smoking services. NRT support, when you say limited prior to surgery, what does that mean? If they're on higher dose, lower dose. Casino, do you want to just say what you meant by that? Are you talking about the animal studies? Okay, the animal studies, just keep it in your mind that in the animal studies they used very high doses of nicotine. Now animals, you don't get to chew on a piece of gum, obviously, you have to infuse the nicotine into them. So it's much higher they were receiving much higher doses of nicotine than they would have got with nicotine replacement therapy in general. Okay, so don't worry about that. You should use the ministry guidelines for supplying the NRT. Use that algorithm, which you will know about, and use the right dose for the person.
What else I want to ask? So thank you for this.
Hi, Hayden. Is there anything around vaping pre-surgery?
Yeah, there's a few papers that are starting to emerge that have used vaping to help people stop smoking. So, it runs into the same situation that vaping provides nicotine and maybe as much as you get from smoking, but without carbon monoxide and the other things. So vaping prior to surgery is going to be less risky than smoking prior to surgery. Some anaesthetists are still a little bit unsure and might want people to stop vaping the day before surgery. That's okay, but as long as they don't relapse to smoking, which is by far the most risky. I think for those of you who have been on the NTS update day know that there are a recent trial that shows that vaping is more effective than nicotine replacement therapy for smoking cessation. And Natalie Walker from the University of Auckland presented her data from the trial at a conference I was at last week, which also shows that vaping with nicotine is significantly better at helping people quit smoking than vaping without nicotine.
I guess that's the issue with trying to get surgeons and anaesthetists on board around that, their reluctance around vaping.
I think
it's our role to share that.
Yeah, it is your role, and you're the experts in the area, not them. It does need a bit of confidence, but you could send papers. They still might be a little bit, reluctant because these are high doses of nicotine. But again, that review shows that it's probably not the nicotine that causes the harm. It's the other things in tobacco smoke that cause harm in regard to post-operative complications.
Bye-bye.
Okay.
Okay.
Well, that's the half an hour almost up. Any last questions? as always, we'll put this up on our website in the next couple of weeks, so it's there for others that didn't get to join today. Otherwise, we'll speak to you in roughly a month's time. So we'll be sending out the invite for the next webinar. And again, as always, if there are any suggestions, please let us know. Oh, just one question from Maurice. So 6 months would be the recommended time to be smoke-free before surgery. No, I think probably 8 weeks is ideal, but even if it's 4 weeks prior to quitting, that's absolutely great. So yeah, don't get too bogged down to that with that time point.
There's a second part to the question as well. Would surgeons still operate on someone?
Would surgeons still operate on someone who was smoke-free for a month? Yes, they should. Yeah, absolutely. Can you please include recent vaping research circulated with this, please? Yes, and we might just try and slot in a webinar of the recent vaping research, perhaps. If you did attend the update, it is in the update, but we might do something if that's useful for you, maybe next month.
Goodbye. Okay.
Okay, ka kite.
Ka kite.